I have many patients come to me, ask me this question: should I go for medical treatment? Now, this is a very comprehensive question. Now, being medically trained in oncology nursing, I would advise most of my patients must seek medical advice. As we know that when a patient has cancer, how extensive in the cancer, it would affect our treatment. So patients should go for investigation first. Now, if, for example, if the patient has colon cancer and has some areas of the lymph nodes affected, and most of my patients will say, oh, I do not want to have a colostomy. Patient is very frightened of colostomy, and they find that colostomy is embarrassing and they cannot cope with life without going normally to the toilet. So this is the frequently asked question. But my advice is, for example, cancer in the colon. Colon is in fact is a silent organ. When patients have symptoms, they to reveal that they have cancer in the colon, meaning their cancer is already spread to certain lymph nodes and so on. But if you don't go for surgery, for example, the whole colon can block up, and they cannot pass through, and this is going to cause intestinal blockage and it's going to cause problem. And of course, if the cancer is extensive, we do not take away the whole group of cancer cells, and your body environment is still acidic and poor circulation, poor immune system, and cancer can spread like wildfire. So this is life-saving. Life-saving means we take the whole localized cancer first. Then the remaining of the cancer, you can either take the doctor's advice, go to the chemotherapy and radiotherapy, and at the same time we combine with this range of products, and you can see that patient is more comfortable and their recovering rate is so much higher. So I always advise patients, if they have any tumor found anyway, go straight to the doctor, go for the investigation, and especially get a CT scan, and this will help me also to either to give what dosage to you. But if I find that your most of your organs or is not affected, and your lymph nodes is not badly affected, you take a smaller dose. And smaller dose that may be 1 bottle of GL powder and a few RZ and a few ml of the codipine and morinzi and spirulina and so on, and it's safe cost. Okay, so but if I find that the cancer is extensive, we have to combine with doctor. We have to give mega dose. If you know that if you don't have surgery, give an example, and I give you high dosage of microvita, and you will feel very uncomfortable. If your tumor in the colon swell up, it's going to cause obstruction in your intestine, and that is going to give problem to you, which I don't think I would like you to suffer during the treatment. So I always advise, go for expert opinion, go to the oncology or the surgeon, and at the same time bring back the medical report to me, and I will definitely give you the best advice. I have another frequently asked questions. They will come to me and say, Jane, I have no money. And this is the saddest thing. That's why I always emphasize on prevention is better than cure. Prevention means you and I, we are healthy, and we just want to maintain a healthy environment, like balancing the pH. Maybe we just take 20 ml of the morinzi or the codipine daily to ensure our body is balanced, and then we take a few capsules of the RGGL to ensure the circulations is patent and good immune functions, and then the good nutrients from spirulina and so on. So Well, then there is about a few hundred ringgit to maintain good health. But the problem is people don't normally think that prevention is important. By the time they come to me, they find health problems and they say that they don't have money to take the products. I feel sometimes it's very sad. It's very sad. So I always advise them, okay, ideally they should take according to the dosage I have recommended. But if really don't, I will depends on their problem. For example, if they have breast cancer, now I will, okay, you just start with balancing the pH first and balancing the hormones first. I will give the simple recommendation by giving the Morinzi 30 ml with cordyceps maybe 2-3 times a day, and then some spirulina 10 tablet 2 times a day for this month. Okay, and the next month I will advise them to go on the RG and GL, maybe in the powder form, the Mycovita. Start with half sachet, and they take it half sachet or 1 sachet daily, and then they come back. They will come back to Morinzi and cordyceps, and it is effective also. But if the patient is on chemotherapy, then the most important product that is needed by the patient is GL powder. GL powder during chemotherapy, most important is you need to help and support the patient to be able to go through the chemotherapy without complications. That is by enhancing the immune system. So this is the essential. Normally, a patient can't afford anything else during chemotherapy. I will emphasize that mycelium is essential. Then they'll take maybe 1 bottle daily to ensure they go through the 6 cycles of chemotherapy, and later on we come back with the rest of the product by balancing their pH, circulation, immune system, oxygenation. And on top of that, I emphasize on, because the product range is low, they have to take more effort by controlling their diet. That is, they should cut down to very minimum the acidic food, the meat, and white bread, and all the sugary sweetening drinks, and all this. And they have to make an effort to do more exercise, because exercise improves blood circulations, enhance their immune system, and they can even take some sort of qigong, which is quite common among the Malaysia, because the exercise, the principle is also by improving the circulations, enhance the immune system, and increase the oxygen. So this is effort. I have another frequently asked questions. In fact, especially patients who is undergoing chemotherapy and radiotherapy, doctor will say, don't take anything except doctor's prescription multivitamins. And I find that most of the patients has been misled by the doctors. I give an example. I have a patient who has breast cancer, and she went to the hospital, one of the popular hospital, and the doctor advised her not to take anything else. So when I explained to her, when someone who has cancer, number one, your blood circulation is affected by the pH of the body, and microcirculations and all that, and immune system, and it can affect the therapeutic effect of chemotherapy. So therefore, I encourage her, although she's going through the chemotherapy, she should take this range of products, especially the LGGL powder, and then this Morinzi and cordyceps and spirulina. During chemotherapy is important because they equip themselves with a healthy body environment, and at the same time it improves microcirculation and enhance the therapeutic effect of the chemotherapy, and that will give them better healing effect. And so of course, after I explained to this patient, the option is hers. So she opted for, during chemotherapy, she took the whole range of this product, and she suffered very minimum from side effects. So throughout her 6 cycle of chemotherapy, she could follow the schedule according to the treatment. So till today, 10 years later, she did not have any relapse. But when she was in the hospital looking at her other patients who went through the same therapy, and she was sad to see that some couldn't even go through the 2nd cycle or the 3rd cycle of chemotherapy due to poor blood count, either it was a low blood count or low white blood count, platelet count, or hemoglobin, and so on. So today she will stand up for us and say that this range of products is essential for patients with chemotherapy and radiotherapy. And of course, there are some doctors advise patients who is going through whatever chemotherapy or radiotherapy not to take spirulina, which is, I find that is a misconception, because as we know, doctors, they study very minimum nutrition, they study more on drugs and disease, so they are more on drugs and disease related base. So when they ask patients not to take spirulina, they were thinking this is vitamins. It's rich in iron and rich in calcium and so on. They thought this can overload the function of the liver and kidney. So they advise the patient not to take too much. But for your information, I have been giving my cancer patients, especially leukemic patients, they are taking 10 tablets 3 times a day, even 4 times a day. And a good example is my father. My father had prostate cancer, and throughout his 4 years of therapy, he is taking 40 tablets a day, meaning he's taking 10 tablets times 4 times. Till today, he is a healthy man, because my father had metastasis in the bone. So we can see the dosage of the treatment is important. Spirulina is a wholesome food, it's not an extract. So whatever the nutrient that is contained in spirulina, chlorophyll helps us to build red blood cells, and of course it will not burden our kidney or liver. In fact, it improves our kidney function and liver function. And a lot of doctors, they are not aware of this. So at the same time, the chlorophyll makes our body to build new red blood cells, and in fact it gives less burden to the liver and the spleen. Therefore, you can see that most of the patients has more stable emotion after they take spirulina. So I emphasize on patients with chemotherapy and even radiotherapy with poor appetites. They should take more spirulina, which is very safe. Finally, I would like to emphasize on prevention is better than cure. As we know that there are so many contributing factors that leads to the cause of cancer, especially about 70% is caused by food. So we have to create health awareness that the acidic food and stress contributes to pH in the body, acidic body, and poor blood circulation, and poor immune system, poor oxygenation, and have poor emotion, or they are unable to cope with stress. So I have come up with a very strict solution, especially people who do not want to exercise. When people do not want to exercise and their body is acidic, they love to eat acidic food, and the blood environment, I will tell you, is very bad, it's sticky, and it can cause a lot of problems from high blood, diabetes, and cancer. So for this type of people, it's essential. We must take codipine, 30 ml at least once daily, and codipine also 30 ml once daily, and RZ and GL, they are essential. Okay, now at least 6 RZ and 6 GL daily, and followed by Liaman, at least 3 tablets 2 times a day, and spirulina 10 tablets daily. But for example, if your lifestyle is stressful and you are the type who love to overeat and you don't exercise, then of course you have to increase the dosage. With these 6-RG and 6-GL, they want to do a lot of functions in the body, balancing the pH, and then they want to dig out the blockage of the circulation. They want to patch up all the problems, cells, organs, and system. And this range of product, of course, is not enough for you. So if you are leading a very stressful lifestyle with no exercise, and you are a food eater, you like to eat lots of flirty food, then please, you have to double the dosage. Maybe you take 30 ml 2 times, even 3 times, and then you increase your RG and GL to maybe 12 pairs or even 15 pairs, okay? And then spirulina, you can maybe take up to 10 tablets to 20 tablets. So this is how we adjust the dosage for prevention purpose according to our lifestyle. But if you are a smoker, you are the drinker, then please increase your dosage. Now, for people who already have cancer, now, first thing, they go to the doctor. Once the doctor tells them they have cancer, of course they are very frightened, they are so very confused, do not know what type of treatment they should go for. But in the end, they have to face it. Either they go through surgery, they go through the chemotherapy or radiotherapy, and be confident. This range of products that I have mentioned, now, during chemotherapy, at least 1 bottle of the GL daily to enhance the immune system and prevent the chemotherapy side effects by giving Liamans 10 tablets 3 times, and of course at the same time Morinzi and Quadripine should be at higher dose, 30 ml 3 times or 4 times, spirulina maybe 10 tablets 4 times, and maybe cordyceps 5 capsules 2 times or 3 times. And these are the range of products the patient who is having cancer, they should comply. But once they finish their chemotherapy according to the doctor's schedule, of course the next step is we have to take action to prevent relapse. We know that cancer, if the patient is going back to their old way of eating, eat too much meat and do not exercise and go back to smoking or drinking the alcohol, and the relapse can come back very fast. So you have to change your way of eating and change your way of lifestyle. Maybe you stop smoking and exercise more and maintain a minimum dose of this range of products, and we can prevent relapse. So the health is within your hand, whether you want to take it or leave it. Thank you.